Hello, I am Eli Adashi, Professor of Medical Science at Brown University and host of Medscape One-on-One. Joining me today is the Honorable Kathleen Sebelius, Secretary of Health and Human Services. Our topic, the implementation of the Affordable Care Act, now at the 6-month mark. Welcome, Madam Secretary.
Thank you.
It's
good to
wonderful
be with you.
to have you.
Thanks.
I seem to recall you're sitting in the Senate gallery during a key vote during the great healthcare debate. You obviously sensed history in the making, or else you wouldn't be there. How do you think of it today, 6 months later?
Well, I still think we have seen the President sign into law what may be the most significant health care bill in the history of our country, certainly in the last 45 years since Medicare was passed. We have had a front row seat here at the department in putting the pieces in place that are beginning to show real benefits to people, and it has been a very exciting time.
Are you at all concerned about the background discussions about repeal or some other ways of constraining what was such a mammoth effort?
Well, of course, I am concerned. I think that the more Americans understand what the law actually does and doesn't do, and once they begin to feel the benefits for themselves and their families. We heard from a lot of parents, for instance, who had children graduating from great schools like Brown who now can keep those young adults on a family plan. They were thrilled. Parents at the 6-month anniversary will be able to have children with pre-existing conditions. Some, for the first time ever, have health insurance that they can count on. Seniors are beginning to see some help with prescription drug costs. So as people figure out what this does for them, we're seeing people being more enthusiastic about the program.
I think you're referring to a whole series of patient rights, in a sense, that are going to kick in come September 23rd. What element, would you say, of the Act do you consider the hardest to implement?
Well,
what keeps you awake at night?
There are some pretty daunting timetables in the bill, and actually as the discussion in the House and the Senate slipped from 2009 into 2010, none of those timetables were changed, so that we have been working tirelessly to make sure that the regulations were written in a timely fashion and that the benefits that people are looking forward to actually come into the marketplace. So this 6-month anniversary is an important date, and what I'm pleased to say is that companies are prepared to implement the changes. I think people will be seeing some new benefits, and also we have this great new website, Dr. Adashi. I don't know if you've had a chance to visit it,
I should say, yes.
Healthcare.gov.
I think we might just as well say it.
Absolutely, up and running, and some tools for consumers. I mean, you could find more information out about a toaster you wanted to buy than about health insurance that might be available to you in the past. And this,
absolutely.
I'm a big believer that informing consumers is a big way to get some more power into people's hands.
Well, my wife is certainly a fan. She has a mother who needs individual health insurance, and she's already checking it out.
Well, good. And tell her that in October there'll be pricing information added to the plan information. So again, a big step forward.
Well, thank you. With about 32 million patients joining the insured ranks, will the Act be expanding the medical provider workforce, which is a concern out there?
Sure. And it's a concern whether or not we pass the Affordable Care Act. We need more doctors. We need particularly more primary care physicians in underserved areas. I just came from a an announcement of an additional $130 million in workforce grants, some Recovery Act money, some Affordable Care Act money, that will begin to populate the pipeline. The president has been very focused on workforce, and so we're doubling the size of the National Health Service Corps, which is our...
For the community health centers in particular.
Well, it's community health centers, but it's a variety of practitioners. We pay off their medical loans in exchange for a couple of years of service in an underserved area, and that has been a very effective strategy, but we'll have double the number. We're putting more money into nurses training and nurse practitioner training, into mental health techs, and beginning to change the payment rate for primary care docs so more medical students can see it as a viable option going forward. So workforce is definitely a part of the plan, and we'll have at least 16,000 new primary care providers in the next several years, and I think that's very good news.
In what other ways, since we are discussing primary care, will the new act facilitate, if you will, the practice of primary care in general?
Well, there are a couple of pieces of the puzzle. If you think about what we have now, I like to call it a sickness system, not a very good health system, because there's a lot of time, attention, and money spent once someone gets ill in treating that illness, not very much focus or attention on preventing that illness in the first place. So there are new investments in preventive care, not only consumer benefits, so insurance companies will begin to cover screenings for cancer and immunizations for kids and a whole variety of preventive care without copays or coinsurance. But also we're focusing on some community efforts to reduce smoking, to reduce the rates of obesity, both of which are big underlying causes to a lot of chronic illnesses. The introduction of electronic medical records, which allows a primary care doc, I think, very effectively to coordinate care of his or her patient. So no longer will the specialist not be able to talk to the doctor and coordinate the medicine with the pharmacy, but tying that information together and allowing a patient to sort of do one-stop shopping, have a snapshot of what's going on, and have doctors and hospitals and nursing homes work much more closely together, but around a primary care model. There's a new effort on a medical home, again, around the notion that having a health home, making sure people have regular checkups and have a medical provider, that again is a strategy to not wait until somebody comes into an emergency room, not gets checked into the hospital, but keep them healthier. Yes. So not only more docs better paid at the primary care level, but some other strategies that I think will reorient our healthcare system to primary care and preventive care.
So really a real array of initiatives that hopefully complement each other and to produce an improvement.
Well, just a snapshot right now.
Please.
We spend in America about 75 cents of every healthcare dollar we spend is treating chronic conditions, diabetes and heart disease and other issues which we know if we spent some time and energy at the front end, we might be able to prevent. So it's not only good for the overall budget, but it's going to save lives, I think, and have a more productive workforce, because we currently spend a lot of money but don't really have health conditions in Americans that look very good.
Well, on this note, sincere thanks to Secretary Sebelius and to you, our viewers, for joining Medscape One-on-One. Until next time, I am Adashi.